Hello everybody, my name is Wendy Harder. I'm a certified operating room nurse at Duke Health Raleigh Hospital. I've worked in the Duke system for 21 years, first as a certified surgical technologist and now as a clinical OR nurse. I have scrubbed and circulated every surgical specialty on every shift, including trauma, transplants, replants, neuro, ortho, plastics, ENT, and eyes. My patients have ranged from preemie newborns to over 100 years old. I specialized in breast oncology for about 2.5 years, and now I work on the general team, which means that I participate in any abdominal surgeries, thyroid and parathyroid surgeries, cardiovascular, gynecology, urology, cystoscopy, and endoscopy procedures. I'm a specimen resource nurse and a new to the OR preceptor. To be honest, there are a few reasons for me to pursue a master's degree, beginning with the fact that my hospital has a pretty robust reimbursement program, and I think it's silly to not take advantage of that. Also, the operating room, like most of nursing, is very physically demanding. As a cancer survivor, I know firsthand how difficult it is to lift, push, pull, carry when you don't feel well or have had an injury or have had surgery. I'm hopeful that teaching will give me an avenue to continue nursing should I ever not be able to physically work in the OR. But this program isn't easy, and neither of these would be enough reason for me to, on their own, for me to go through all of this if I didn't love nursing as much as I do. I'm pretty passionate about making sure that our new nurses have the opportunity to gain a deep understanding in their role. This helps ensure that our patients receive the best care possible. I really enjoy and think it's important to teach the big picture perspective, because I've seen that when a student or orientee understands the environment from the outside in, or from the larger picture to the smaller details, he or she can adapt better to a changing environment. As an example of this, when we're doing gallbladder surgery, I think it's important for a person to understand that the gallbladder may be adhesed to the liver because of the inflammation that's been involved, and know what your hemostatic options are in case of bleeding. A lot of times people teach the specific procedures that a particular surgeon uses to perform a cholecystectomy. Students and orientees and even more seasoned nurses often tell me that they really didn't understand what they had been doing until they approached it this way. And this has motivated me to learn more so that I can have a deeper understanding of education and how to be a better educator. Until now, I've not had any real experience with online learning, but I enjoy writing, so the format seems to fit well for me. And at this point in my life, when a lot of traveling would be a burden, I enjoy distance education. I'm really looking forward to learning with all of you this semester, and I wanted to leave you with this quote on this t-shirt that I love from Florence Nightingale, which says, "Let us never consider ourselves finished nurses. We must be learning all of our lives." Thanks, and I enjoy working with you guys this semester.